Hi, welcome to another video with Hillsdale Hospital. Today we're talking about pregnancy and the postpartum experience and everything in between, and I'm going to be pulling some myths and misconceptions out of this mug here, and our lovely OB-GYN team here will be talking about whether or not they're true and helping to spread some awareness. So I will have them introduce themselves.
I'm Rachel. I'm the nurse midwife at Hillsdale.
I'm Dr. Odell. I'm one of the OB-GYNs here.
Hillary Zimmerman, the clinical nurse manager of the obstetrics floor at the hospital.
I can predict my baby's sex based on the shape of my belly or face. Is that a myth or is that the truth?
I think that's an old wives' tale.
Yeah.
Yeah.
Hear that.
Where if you carry high or if you carry low, it's a certain gender, but I don't believe it has any.
Everybody's different.
Yeah, I'll say. I've had people tell me that they thought it was a boy because it carried a certain way and then ended up being the opposite gender at birth, so.
Are there any indicators that you can rely on to tell you, or is it just an ultrasound?
Sometimes with nausea and vomiting, we know that girls have a little bit higher estrogen levels, so they might make nausea worse, but that's not always the case. So there is a little science to that one, right? But not much.
Okay.
A lot
Yeah,
of people will say the heart rate, baby's heart rate, if it's higher, it's a girl, lower, it's a boy, but
that's not
also
true.
it's,
Okay.
babies are all different.
Yeah, like if a baby is moving a lot, their heart rate's going to be high. Just like if we're exercising, our heart rate's going to get high. If the baby is sleeping, their heart rate's going to be low. So if it just happens that we listen to baby while the baby is exercising or moving a whole lot and the heart rate's high, you know, that just means the baby's moving a lot. If the heart rate is lower, it may mean that the baby is having a sleep cycle.
The size of my baby affects how painful labor and delivery will be.
Labor it's a good pain. So we all experience some sort of pain during it. But having an 8-pounder versus 6-pounder, I don't believe affects how much intensity of the pain you're going to get. The purpose of labor is to have a baby, so it's all going to be generally the same.
Yeah.
What about the length of labor? Does the size of the baby affect that?
If a baby sometimes is not going to fit well in the pelvis and it's big, like if the pelvis is not, you know, sometimes we don't want to say cephalopelvic disproportion because that's an old term, but if the baby is not fitting well in the pelvis, the labor can slow down a whole lot, and that could mean a big baby. But a big baby for one woman is not a big baby for another. So some women have 10-pound babies and they do just fine with it. Some women have, you know, a 7-pound baby and the labor doesn't progress. So the specific size doesn't necessarily matter. It's just if the baby and the mom are proportioned to each other.
Babies always arrive on their due date.
Never.
Tell us about it,
Sounds like a
Hillary.
myth.
Yeah, some do, but babies come when babies want to come. Every body is different, so your due date is estimated. Some know, but it's an estimated due date, so it's 1 week on both ends. So don't get discouraged if baby doesn't come right on that date. It's a good generalized idea of when the baby should be term and healthy, but not the exact date that they would be born. We like babies to be at least 37 weeks gestation because we know that they're developed well enough that they would do well outside of utero. Post dates
If you're going
is different.
if you're going like 42 weeks, baby needs to be born. But if you go past your due date, there are risks of bigger babies keep growing. There's risk of preeclampsia, and there is a risk of stillbirth because your placenta does get more calcified and older. But that's different for everybody. So that we usually have a talk. Not saying we would, you know, you have to be induced right at, you know, your due date and stuff like that. But we do monitor you at the hospital on the monitor if you decide to go 41 weeks or beyond.
Okay. Because like you said, everyone's a little different.
Yep.
So that placenta is an organ that is only meant to be there for so long to keep baby growing in utero. So everyone's different. So that may start to calcify sooner than others. So that's why that close monitoring around your due date if you're going to go post dates.
Yeah.
Just so we can make sure baby's still growing healthy, mom's still fine. Just closely monitor.
After giving birth, I will feel the same mentally and emotionally as before I was pregnant.
It's a lot of hormones that have to shift afterwards. And whether it's your first baby, your 10th baby, the, getting used to a new routine is emotionally, mentally. It's difficult for everyone in different aspects, learning a different routine.
Yeah.
So I think that's where that really close follow-up postpartum is so important.
Yeah.
And just having those realistic expectations too going into it so that you don't have a hard time postpartum.
Yeah.
Yeah. Okay.
And a lot of women too struggle with how their body looks after they have a baby. So during pregnancy, it's kind of easier to accept body changes because everyone knows that you're pregnant. But sometimes maybe within the first couple weeks of you delivering, people might comment, oh, you're still having a baby because your belly's still a little bit bigger. And that's mentally kind of exhausting for women to go through all of these bodily changes too. So I think that's something that we sort of don't talk about quite enough in women's care and pregnancy, something that women will experience.
I think you gotta remember, you grew a child for 9 months, and it's gonna take a little longer than 2 weeks to
come back to normal.
Snap right back to normal, and you shouldn't have that expectation of yourself
No.
ever.
Yeah.
Because you're caring for a whole other human being.
Yes.
So.
Yeah. What would you recommend, maybe first-time moms or not even first-time moms, how should they prepare for that postpartum period when nothing is the same and everything is changing and there might be some, hormonal changes that are difficult to adjust to?
I think finding a good support
Yes,
Yeah,
that's the
system
biggest
is
thing.
Absolutely.
number one. That
Yeah.
should be like the number one thing on everyone's birth plan even. What is my support postpartum?
Yes.
So that you do have someone that you can talk to, one, and number two, just if you need a break once
you
in a
need a
while.
break.
So someone you trust that can just give you 10 minutes to take a hot shower and maybe remind you to drink your water and maybe eat something, or I think the support person would be number one.
Yeah.
Okay.
Someone to help make meals and clean the house and do the daily sort of things. Especially a lot of times partners don't get a whole lot of time off of work like the patient does. The patient may get maternity leave, but the partner may not get the time off that they need to fully support our patients. And so finding somebody else who might be able to fill that role. And then it's not just supposed to be one other person, right?
Yeah.
It's supposed to be a whole community of people. So finding your community is really important. And we have some really good examples of that in our community. Like, sometimes it's a religious kind of circle of people that are helping. Sometimes it's a mom's group that's helpful. Sometimes it's, something else. But finding that, I totally agree with that.
Okay.
Well, and having that open communication with, before even baby's born, with whether your family or your friends, and just be like, hey, do you think, after baby's born and, I'm at home, would you be able to come over just for a little bit and watch baby just so I can sleep, or help me with my laundry, or just let's go exercise together and let's just talk, or whatnot too. And the biggest thing also is give yourself grace too, right?
Right.
Being a mom, is whether it's your first or 20th, it's a lot of work, and I feel like us women are very hard on ourselves.
Yes.
So you all are gonna be great moms. So just make sure you tell yourself that.
Advice I should have given myself a long
Yeah. Women are hard on themselves.
We
They
are,
think they're
yeah.
super women and they
Yeah.
can
Do it
clean the
all.
house, breastfeed the baby, go back to work and do it all.
Yeah.
It's okay. You can't do it all.
Yeah. Okay, the next myth is getting an epidural will increase my chance of needing a C-section.
Depends on kind of how you look at it. In general, we would say that's not necessarily true.
Okay.
But there are situations where that can be true, to be quite, transparent. If the blood pressure gets too low and we're not able to get your blood pressure back up, you may need a C-section, but that's pretty rare. In general, 85% of our patients get epidurals, and they do wonderful.
Okay.
As far as labor progression, that's not true at all.
Okay.
Epidurals do slow down labor, but it's about by 30 to 60 minutes. It's not by, it's not
the whole thing.
It's
stalling.
It's not the whole thing stalling out. So we do know that it might slow things down slightly, but that's not enough to increase your chance of getting a C-section.
Okay.
It would be more of if there was a complication.
From the epidural. But you're also not like once you get an epidural, you're not just laying in the same position in bed.
We don't let you do
No,
that.
we don't.
We're rotating you. You're going on your side. You're going on your side. We're sitting up in what's called the princess position, where you're sitting straight up, and there's different positions we get you into to help change the angle of the pelvis for a little one too. So, and I feel like you, Dr. Odell, said, a lot of our patients do get epidurals, and majority of them
Do wonderful.
do amazing. So.
And then there are, I'm so sorry,
go
there
ahead.
are situations too where actually getting an epidural averts us from getting a C-section.
Yes.
Oh,
So,
say that.
yeah, a lot of times if you're a first-time mom, we see that a lot, right,
Mm-hmm.
with first-time moms, and you're just in so much pain and it's taking so much effort to dilate the cervix. If you can get an epidural and relax, the pelvic floor can relax and the baby can come down.
Okay.
So sometimes our labor will stall out for 6-7 hours and we're thinking, oh, something's going on, you're having strong enough contractions, but if you can relax with the epidural, the baby can come down. So I would say in general, we avert a lot more C-sections than create them with epidurals.
Okay.
So there's good and bad to everything, any intervention, but mostly it ends up being a very good thing for our patients.
Okay, yeah. You were talking about different positions. Can you get up and keep walking around and things like that for the whole time, or is there a limit when that kind of stops?
It does make your bottom half numb, so it's not
Okay.
safe to get up and walk. But
Okay.
we use peanut balls,
Squat
squat bars.
Yeah.
We make the bed go into all sorts
Yep.
of different movements. We can still get you in hands and knees.
Yeah, we do that a
Um,
lot.
And that helps tremendously. But there's different things that we do side to side, sitting. Like we kind of go through a bunch of maneuvers so that
Okay.
we're constantly making that baby move just like you were if you were up walking
Right.
Oh, I
around.
see. Okay. Okay, this we kind of already answered, but I'd be interested to see if you have anything else to say. This one is, my body will go back to normal right away after delivery.
No, it's kind of like what Hillary said. You grew the baby for 9 months. It's gonna take time. So
Yeah.
Yes.
for everything to go back.
I would say you can never compare yourself now to any time in your past
Yeah.
for anything.
Yeah.
Right.
Because-
5 years ago is
Yeah,
different.
it's different. Is my body the same now as it was after I had my first baby? Absolutely not. But you just have to think of what you've went through. Some moms who breastfeed, or moms that don't breastfeed, like different parts of your body are going to look different.
Yeah.
So everyone is different in that.
Mm-hmm.
Some
Okay.
women do, I don't want to say
Some-
snap back to when
Yeah.
they were, but it's unrealistic to think that
Mhm.
everyone's going to do that.
Yeah. And then, some women have stretch marks and those kind of get better with time, but they never go completely away. Some women will have kind of more laxity and some skin in certain areas and some women don't. So it really is pretty variable.
Okay. Okay. What about things like energy levels? How do those change?
Well, with a newborn, you're up, taking
Yeah.
care of a newborn, so certainly your energy is not going to be the same. But
Yeah.
after the baby is sleeping regularly and if you have a good life balance, your energy should be the same as it was before.
Okay. Morning sickness only happens in the morning.
Yeah, you can get all day sickness. That's what,
Great.
unfortunately, and it doesn't happen to everybody, though. But there are some ladies who predominantly just when they get up in the morning and their stomach is empty, they just feel that wave of nausea and then they'll throw up. And there are unfortunately some ladies that do get where it's like an all day thing. The biggest thing is a complete empty stomach, a completely full stomach. That can all cause nausea. The hormone, what I was talking about, can cause it as well too. So everybody's different on how it varies.
Okay. Okay. Great. Is there any advice that you typically give to moms to kind of tone down the nausea or just kind of cope with it and get through it?
Well, I always recommend, especially if it's like right when they get up, is like have a little bit of crackers on their side of the table and just like when you wake up, just kind of eat a little crackers, get something on your belly and see if that helps. Ginger is the number one thing for nausea. So ginger ale, ginger tea, the smell of ginger helps with nausea as well. Just making sure you don't eat like 3 big meals throughout the day. Eat snacks. Small meals, because like if you just eat a big meal and then fill up your tummy, that's when nausea starts to hit too with a full stomach as well.
Okay.
Too full or too empty.
Yep.
Yeah,
That's what
makes
causes
sense.
the nausea. You're gonna have foods that are gonna trigger it, so just avoiding the trigger foods.
Yeah.
So
Speaking of these myths, is it true that when a mom becomes pregnant, her only wellness visits are with her prenatal care physician and midwife, or are there other people that are a part of that?
Well, it's funny you should bring that up because we have started something called Centering Pregnancy, which is an international program, and we're so lucky to have it here. We've had a really dedicated team to help bring it to Hillsdale, but actually it's group prenatal care. So let's say that you're due in August. You'll be in a group of women who are also all due in August, and we meet for about an hour. We check on baby, we check the fundal height, which is measuring your belly, check your weight and your blood pressure, make sure that there's nothing going on with you, but then we meet together as a group and do lots of activities, education. There's always coffee and tea, snacks, food, but it's a great environment to have a very healthy pregnancy, improves the outcomes for babies and moms, so we really encourage everybody to get involved, but it takes the place of your regular prenatal visit, so it doesn't have to be that one-on-one sort of awkward visit. It can be in a group setting. We have a really beautiful space for it. We listen to some nice music. You can bring your partner. Everybody can be involved. You can even bring your kids. We have a little kids room where they can play and read books, and if you wanted them to watch a show, they could.
So if you're currently pregnant and doing one-on-one traditional care, can always ask about centering. We have groups going every month that they could enroll in, and then, like you said, August. Maybe an August due date, then we're enrolling those gals right now.
Great to hear. And how often do those centering groups meet?
It's every 4 weeks until you're about 27, 28 weeks, that time frame, and then it's every 2 weeks.
Okay, great. Well, if you want to learn more about this, you can go to hillsdalehospital.com/OB-GYN to see all of the information about the birthing center and our prenatal care, and of course ask in the clinic when you're there. Thank you all so much for coming to do this. I think we educated our community a little bit. I definitely learned something. So thank you, and we hope to see you back soon for future content from Hillsdale Hospital.